Hey, welcome to another episode of NYC Let's Talk COVID. I'm your host, Matt Richards, and today we're speaking to Dr. Amanda Johnson about isolation, quarantine, and the Take Care program. Not only is Dr. Johnson the director of the Test and Trace Course Take Care program, she is also the assistant vice president of care models in the Office of Ambulatory Care and Population Health for New York City Health and Hospitals. Now that's impressive and a mouthful. But before we get to Dr. Johnson, let's talk about this week's COVID Need to Know. Everybody listen! Vaccine eligibility is expanding rapidly, and that's really exciting, okay? Recently, a member of our street team was able to get her first dose, and we wanted to share her experience directly, okay? Take it away, Millie!
Hi, my name is Millie, and I just got the first dose of the COVID vaccine. I got the vaccine because I want to keep my family and my friends safe. I'm super afraid of needles, but the process was quick and easy. I didn't even feel anything. This pandemic has been so stressful. There's no more live shows. I can't go to bars and stuff and see my friends like I used to. I can't travel to see family. So finally getting the vaccine was a huge relief for me. If you're on the fence about getting the vaccine, I highly encourage you to get it because I haven't felt this optimistic in such a long time. So if you're single and you just got vaccinated and you live in an apartment alone with no roommates and an in-unit washer or dryer, call me.
Thank you so much for sharing your experience, Millie. I just got my shot, and I'm not gonna lie to y'all, I feel fantastic, okay? I'm shaking hands with no coverings like it's 2019 all over again. I'm still wearing my mask though, okay? The shot don't mean you gotta ditch the mask. All right, I got some questions. You ready?
I'm ready.
Why is it important for people to separate from people they live with if they think they have COVID-19? And what should I do if someone I live with has COVID-19?
Yeah. So it is important for people to separate from the other individuals in their household just because transmitting COVID to other people in your house is just so darned easy. We talked about the fact that you spread COVID by transmitting your respiratory droplets to another person. So if you are breathing the same air in your apartment, it's going to be a really easy way for you to transmit COVID to another person. We also know that New York apartments tend to be small. You might have more than one roommate. You might have more than one generation living in a household. So you have a lot of people sharing the same space, making it really possible for infections to spread quite quickly. That's more hands on doorknobs. That's more people passing through the kitchen, more people passing through the bathroom. We also know that household transmission can happen quite early on in the course of somebody's COVID infection. And that's why it's so important at the first signs of symptoms or the first knowledge that you've been exposed, that you extract yourself from that environment, that you separate either in a different location available to you or in one of our Take Care, isolation, or quarantine hotels. We have the hotel program for a reason. It is far preferable for the person who is a case or a contact to go somewhere where they're going to have their own bed, they're going to have their own bathroom, they're going to have their own space for the duration of their isolation or quarantine. And isolation and quarantine doesn't last forever. So this is just a temporary accommodation which could really protect you. Now I know that for a variety of reasons, people might decide that the hotel program just doesn't work for them. And if you're going to stay at home, then our Take Care program wants to support you in doing so as well. When you answer the call from a contact tracer, we have the ability to connect you with a resource navigator. This is a professional who works for one of multiple CBOs all across New York City to help you connect with resources that you might need during quarantine. So emergency food delivery, connect you with partners who can help deliver medications, including methadone if you use methadone, give you resources about paid sick leave so that you aren't torn up about what's going to happen if you're going to miss work because of your quarantine or isolation. I think a big part of it is just relieving you of all of these fears about separating from the rest of your life for this brief period of time. And then when you are at home, we need you to maintain 6 feet of physical distance. You should be wearing masks, and anybody else in your home should also be wearing a mask. You should open windows and use fans to whatever extent possible so that you can maintain adequate ventilation. You should clean surfaces that people touch quite frequently. So doorknobs, faucets in the bathroom, faucets in the kitchen, countertops, all of those are ways that you can still end up transmitting COVID. The respiratory droplets are by far the most common way that COVID can be transmitted. If you share a bedroom, try not to share that bedroom. Try to sleep in a space by yourself. And if you do have to share the bed, try sleeping head to toe. You may consider having one person sleep on the floor. I know all of this sounds a little extreme, but this is why we tell people that your hotel is going to be your best option here, because it could be a little bit uncomfortable trying to share quarters during your quarantine period.
Yeah, that sounds wild. But on the plus side, if you do have COVID and you're sleeping head to toe, you're not going to be able to smell the other person's feet.
Anosmia is a real thing, losing your sense of smell.
So Dr. Johnson, I got to know, what is this hotel program? Is it going to cost me anything? And for those New Yorkers worried, do they need to check their immigration status at all?
So, such an important question. So our isolation and hotel program is the way that we allow people to get out of households with roommates, households with grandparents, children, spouses, etc., so that they have a place to safely separate, a place to eat and sleep and use the own bathroom free from interruption or interaction with other people. Now, your hotel stay is free. Your round-trip transportation to the hotel program is also free. The meals while you're there, free. Wi-Fi, free. Cable TV, free. Free local calls. But you have your Wi-Fi, so you can bring your cell phone with you and charge it while you're there. So all of these things are available at no cost to you, just because the city has found this to be such an important part of stopping the spread of COVID-19. The other really important thing to keep in mind is that the hotel program, just as with the other components of the Test and Trace Core, do not ask about your immigration status and don't need to know your immigration status to be able to deliver all of these services. So people should feel free to come use these services without fear.
When do you quarantine? What about before and after testing?
Yeah. So when you're getting a COVID test, if you're getting a COVID test because you've been exposed, you should be quarantining from the time that you get the time of your exposure until your quarantine period is over. Quarantine truly starts at the first moment you realize that you've been exposed to someone who has COVID-19. Getting a test is helpful because if we learn that you actually have COVID, then we can find your contacts and let them know that they also have to quarantine. But you remain in your period of quarantine until those 10 days have passed, regardless of whether you come up with a negative test. A negative test doesn't allow you to exit quarantine. And then if during that time period you do develop symptoms of COVID or you come back and have a positive COVID test, then we'll convert you to isolation. Don't worry about remembering all of these details. Your contact tracer will help you keep all of these little facts and dates straight.
Okay. Now, I've been hearing about this all over social media and from my friends that are living on the dangerous side of life. What is a COVID bubble? And, if you got a group of people that you hang out with and you trust them and you're all outside, isn't that safe?
So people like to talk about having a COVID bubble. They like to think that they are just as rigorous and controlled as the NBA. We know that that's not the case. So if there is a group of people that you hang out with who are outside of your house, keep in mind that they probably also have another group of people that they hang out with outside of the people that they live with. And it is impossible for you to know the status and the behaviors of all of the people who have been in touch with the people that you've been in touch with. So having a COVID bubble, having a small group of friends outside of your house really isn't a real thing. It's not something that's actually going to protect you from getting COVID-19 just because you can't monitor everybody's status.
Okay, here we go. What does it really mean to quarantine? Because I don't think I did it right the first time around.
So quarantining, in the sense that you've been identified as someone who's been exposed to COVID-19, means separating from the others around you. It means maintaining 6 feet of physical distance. It means not going to work. It means not running errands at the grocery store. It means not taking your dog for a walk. It means not going out for a little jog. You really have to remove yourself from environments where you run the risk of transmitting it to other people. So when you're quarantining, you're pretty much staying at home or you're staying in another location where it's just you, a bed to sleep on, a hot plate to cook a meal, and a bathroom. Just the necessities for a 10-day period while you see out your quarantine. And if you develop symptoms, then you might stay separated for a little bit longer as you bear out the duration of your isolation.
Let's go to the street. What does New York want to know?
আমার কি এখন ডাবল মাস্ক পরা দরকার?
And so when wearing a mask, one thing that's incredibly important is that you have to wear it properly. It has to cover your mouth and your nose. It's not helping anybody around your neck, not helping anybody on your ear or on your chin. It needs to fit over your mouth and your nose. That's where the respiratory droplets can get in. The tighter it can fit across the bridge of your nose and the bottom of your mouth, the more effective it will be. The second part is filtration, and this is where that whole double masking concept comes in. The more layers of either fabric, cloth, paper that you have between yourself and the respiratory droplets, the better off you're going to be. And so people are taking to wearing face cloths that have 2 layers, multiple layers to them, or they're putting a disposable mask, like a surgical mask, underneath their cloth masks. It is not okay to wear 2 disposable masks. That doesn't achieve what we're trying to do here in terms of fit and filtration. And then KN95 masks by themselves are just fine. And remember that your N95 masks are meant for healthcare providers. So those are to be used in healthcare settings. So save them
PPE.
Save them for the guys in the hospitals. Yeah, that's the stuff that we need to preserve.
When I see civilians walking around with PPE, I'm like, get that off your face. What are you doing?
Yeah, I know everybody wants to be safe, everybody wants to be protected, but you get so much just out of wearing a face covering that properly covers your mouth and your nose. You can throw on another layer to be extra safe. And then another thing to stay away from are masks that have the valves in them. If you're letting air in and out, guess what you can also let in and out?
Droplets
COVID-19.
from the respiratory system.
You're getting it. You're getting it. Great.
I'm picking up what you're putting down.
Qui já vou me conhecer me exposer?
Yes. So a couple ways that you might learn that you've been exposed to COVID-19. So all of that you just went through in terms of putting down your phone number and your name and your address is meant to support contact tracing at that restaurant. And contact tracing just doesn't exist for restaurants. It's one of the main tools that we have to fight the pandemic in New York City. So you are going to get a call from a contact tracer if someone who has COVID says, hey, I came into contact with so-and-so. They will call you to notify you that you are now expected to quarantine, give you the information you need to do so, and also tell you about the resources available to you so that you can quarantine effectively. And then the last way that you might find out is that there is the New York State, the NY COVID Alert app. So if you download this app, it will send you a notification if someone that you and your cell phone has been around was diagnosed with COVID-19.
All right. Well, we're almost done. I just got 2 rumors that I've heard that I would like your take on.
আমার পিতামাতা যদি এখন ভ্যাকসিন নিয়ে থাকে তাহলে কি আমি তাদেরকে সাক্ষাৎ করতে পারবো ভ্যাকসিন নেওয়ার পরে তাদের সাথে দেখা করতে যেতে পারবো?
The reason that you can't just go off and visit your parents is that even after their second dose, your body needs a little bit of time to mount the immune response. So you're going to need about 2 weeks before you really consider somebody protected after they've gotten their second vaccination. And then lastly, while the COVID vaccinations that we have available are incredibly effective at preventing you from getting COVID-19, and they're really effective at preventing you from ever getting incredibly sick or being hospitalized for COVID-19, we don't know yet if they prevent you from transmitting COVID-19 to somebody else. So it's great that your parents have been vaccinated, but if you haven't been vaccinated, you are still at risk of getting COVID-19.
我听说通过交互计划得到隔离房间很难，是真的吗？
So with the take care, isolation, and quarantine hotel rooms that we have available, it's not as if we have a directory. We say, here are the hotels, just go on up and book a room. There is a process to get into them because we have to manage availability and we want to make sure that at the hotel you go to, there's actually a room for you. So if you are interested in a hotel room, know that we're going to have one for you. What you need to do is tell your contact tracer that you want to stay at one of the hotels. Tell your resource navigator, that's that friendly person who helps you get the things that you need during isolation and quarantine, or call the COVID hotline to get connected to the hotel.
Well, thank you so much, Dr. Johnson. I feel
No problem.
smarter
Thank you
already.
so much for having me.
Anytime.
You're pretty smart to begin with, but thank you for helping to get the good word out there.
Got to. If I don't do it, somebody else will.
Who will?
I don't know. Thank you so much to Dr. Johnson for talking to us about isolation, quarantine, and the Take Care program. Thank you to our street correspondents, Millie and Lita. And as always, thank you for watching. I'm Matt Richards, and this has been NYC Let's Talk COVID. Stay safe, New York.